I'm presenting my TED Talk to you today while barefoot as the day I was born. Well, not exactly as I was born. I recently had a partial amputation of my foot. My health insurance won't cover the special shoes that my doctor has prescribed me. And even if I did have adequate coverage for shoes, there are so few options to choose from, and none that go with this outfit. The shoe debacle is only one of many healthcare battles I have had to fight. This fight for accessible healthcare is a battle more people throughout the United States are facing today, and it is leading to unprecedented levels of poverty and homelessness. If somebody is already on the edge and their community is ill-equipped to support them, illness, coupled with our defunct healthcare system, is often all that's needed to push them over the edge. I was afforded a glimpse into the horrors of the healthcare system when I experienced a devastating fall that damaged my nerves and resulted in the need for an amputation. This devastating experience was made all the more traumatic because I was underinsured and I lacked the means to pay for my surgery. You see, like the majority of United States professors today, I work as a low-wage adjunct professor, and I don't have health insurance through my workplace. Prior to my amputation, an insurance agent sold me a plan that he deceivingly passed off as full insurance when it was anything but. I was hit with the full weight of this knowledge when I was only minutes away from surgery, and the office administrator told me that my plan only covered $100 of this multi-thousand-dollar life-saving amputation. I needed to quickly secure the funds in order for the surgeon to proceed. Luckily, my family came to my aid, and I ponied up. But the medical bills keep coming. A story about my situation was featured in a local newspaper. And as a result, I was lucky to have received an outpouring of support from a generous community. But for every story that makes the front page of the newspaper, there are thousands that are hidden from public view. Every viral story and GoFundMe campaign serves to mask the true depths of a dystopian nightmare that is affecting more and more of us today in the United States. What happens when your story doesn't go viral? Or when your community doesn't have the means to assist you? Community support can curb the worst abuses of the neglect inherent in this system. But it needs to be more intentional, it needs to be more abundant, and it needs to catch the people who, through human error or lottery of birth, easily slip through the fraying safety net and struggle to survive. I always wanted to help those who struggle, so in 2011, I started a student-run homeless shelter. This shelter served both to prevent our neighbors from dying on the streets and also to expose college students to people and experiences that would change their point of view. We learned so much at this shelter. We learned about an unjust system, the challenges of homelessness, but also the beauty of community. And we learned about a path forward so that fewer amongst us need to suffer needlessly on the cold, hard streets. Jay was one of the people in our shelter who taught us so much. And he highlighted for me the divergent trajectory that two lives can take despite their shared humanity and their common potential at birth when race and class are factored into the equation. Jay and I were born on the exact same day. In many ways, I won the lottery of birth. I was quite planned and more than wanted by a family who had means to assist me. And on August 28th, 1979, in a hospital room in Philadelphia, I made my grand entrance into the world. But I was born into a complicated world, one in which not all babies have the same advantages. Some, like me, have all the advantages, while others, like Jay, have to fight daily just to survive. Jay was born into a world of homelessness. From birth to age 4, Jay and his mother fluctuated between sleeping on the cold, hard streets and couch surfing. His entire childhood was spent as a cry for help. And like many brown and black boys and girls throughout the United States, his cry went unheeded. His adulthood was spent trying to gain stable footing. By the time I met Jay, he had come into our shelter. He had been sleeping on the streets prior, but had just gained employment as a chef and was saving money to claw his way back into housing security. We took Jay in and we loved him. He played board games with us. He challenged us to intellectual conversations. He played hopscotch with us. But then tragedy struck. Jay developed life-threatening blood clots in his leg and needed an emergency leg amputation. I spent hours advocating for him with his medical team, but nonetheless, he was discharged from that hospital a few days post-op without rehab or a safe housing plan. By the time Jay was discharged, there were no shelters that could take him. All the shelters in Philadelphia were either at full capacity or not wheelchair accessible. I was constantly comparing Jay's experience of amputation with my own. Even with inadequate health insurance, I still had attentive doctors and nurses, rehab and home care. And yet still I struggled to survive. Without the community care that I received, care that was afforded to me by my own privileges and luck, there's no doubt that I would have died. Jay had fewer resources than I did, significantly fewer, and he was fearful for his life. Jay and I had been living parallel lives. We were born on the same day, and then in our late 30s, developed life-threatening blood clots that required amputation. The dramatically different experiences in between our birth and our amputations is a result of a dramatically unjust system. Jay and I had our lives parallel. When in scrambling to find him solutions, I tapped into the same network that had kept me afloat. Families close to Jay offered to take him in until we could get him a permanent solution. These were families who had helped me through my struggles. Another friend of mine provided Jay with physical rehab and then linked Jay to a prosthetist who custom-made prosthetic limb so that Jay could walk. All of the people who lent a hand to help both me and Jay did so out of kindness. But what we learn when we help each other is that the gifts we gain by helping people who are homeless or just vulnerable, they are far more abundant than any gifts we hope to give. We are social beings, and we want to feel connected, useful, and truly seen. And when we know each other's story and struggle, we practice compassion for each other and for ourselves. And we have so much to learn from each other. Jay taught me so much. He taught me how to lean into our village. His vulnerability taught me how to be vulnerable. He taught me the strength that is required to ask for help. And the bravery with which Jay handled his amputation taught me that this mangled body of mine is a war wound and not something to hide. And I learned that we are all a little freer, a little more whole, when we help each other and bear witness to each other's struggles. When I try to locate the origin of Jay's struggle, I consider all the crises leading up to it. I think about the underfunded and overcrowded shelter system. I think about housing vouchers with a 10-year wait list. Prior to that, I think about an unequal system of housing, labor and wages, incarceration, education, and the outrageous cost of health care. This is a story with multiple origins, but only one possible ending. In the end, we must do better than this. If we are to hack the problem of homelessness and revamp a broken system, we will do so with the support of an entire community. I am advocating for a community, a shelter system that is low barrier and inclusive and allows people access with the 3 Ps: their partners, their property, and their pets, which are not commonly welcomed in homeless shelters. But what we really need is a system change. The old adage goes, it takes a village to raise a child. I have witnessed it takes a village to sustain that child through adulthood as well. This village, it turns out, is my shelter's solution to homelessness. I originally believed that housing would be. But then I learned that sometimes when people achieve housing, they still end up back on the streets if they are not connected to a community. And without community, who knows where Jay or I would be right now? Our inclusive community we advocate for is also ADA accessible. For me, for Jay, and for all others with disability. Participation in this type of inclusive and diverse community on the micro level has the power to propel us into work on the macro level, working for policy change to end our human-made levels of poverty and homelessness. It is policy change that will create a more just system. A system in which you and I have access to affordable prosthesis and shoes, and a system in which all our basic needs are met. This change will occur when we start to think constellationally and connect the dots between systems of oppression and between ourselves and our neighbors. We are all truly connected, and at any time, any one of us could experience a devastating accident, even an amputation. Who is the village you would turn to in a crisis? The intentional bread-breaking village that we are building allows us to weave a tighter safety net to catch more of our neighbors like Jay before they fall. That same net might just catch you one day. And when we tighten our nets and we widen them too, we will ensure that justice is also shielded from the fall. Thank you.